The World Health Organization (WHO) has declared the Mpox outbreaks in Congo and other parts of Africa as a global emergency. Cases have been reported in children and adults across more than a dozen countries, and a new version of the virus is spreading. Unfortunately, Africa has very few vaccine doses. Earlier this week, the Africa Centers for Disease Control and Prevention also declared the Mpox outbreaks as a public health emergency, with more than 500 deaths reported. They are asking for international help to stop the virus from spreading. This should worry everyone, said the World Health Organization Director General Tedros Adhanom Ghebreyesus. The possibility of the virus spreading more within Africa and to other regions is very concerning. The Africa CDC previously said Mpox, also known as monkeypox, has been detected in 13 countries this year, and more than 96% of all the cases and deaths are in Congo. Cases are up to 160% and deaths are up by 19% compared with the same period last year. So far, there have been more than 14,000 cases and 524 people have died. In a statement, and I quote, "We are now in a situation where Mpox poses a risk to many more neighbors in and around Central Africa," end of quote, said Salim Abdul Karim, a South African infectious diseases expert who chairs the Africa CDC emergency group. He said the new version of Mpox spreading from Congo appears to have a death rate of about 3 to 4%. In 2022, World Health Organization declared Mpox to be a global emergency after it spread to more than 70 countries that had not previously reported Mpox, mostly affecting gay and bisexual men in that outbreak. Fewer than 1% of people died. Michael Marks, a professor of medicine at the London School of Hygiene and Tropical Medicine, said declaring this latest Mpox outbreak in Africa as an emergency is warranted, if that might lead to more support to contain them. And I quote, "It is a failure of the global community that things had to get this bad to release the resources needed," he said. Officials at the Africa CDC said nearly 70% of cases in Congo are in children younger than 15, who also accounted for 85% of deaths. Jacques Alonda, an epidemiologist working in Congo with international charities, said he and other experts were particularly worried about the spread of Mpox in camps for refugees in the country conflict-ridden east. And I quote, "The worst case I've seen is that of a 6-week-old baby who was just 2 weeks old when he contracted Mpox," Alonda said, adding the baby has been in their care for a month. He got infected because hospital overcrowding meant he and his mother were forced to share a room with someone else who had the virus, which was undiagnosed. Save the Children said Congo's health system already has been collapsing under the strain of malnutrition, measles, and cholera. The UN Health Agency said Mpox was recently identified for the first time in 4 East African countries: Burundi, Kenya, Rwanda, and Uganda. All of those outbreaks are linked to one in Congo. In Ivory Coast and South Africa, health authorities have reported outbreaks of a different and less dangerous version of Mpox that spread worldwide in 2022. Earlier this year, scientists reported the emergence of a new form of deadlier form of Mpox, which can kill up to 10% of people, in a Congolese mining town that they feared might spread more easily. Mpox mostly spread via close contact with infected people, including through sex. Unlike in previous Mpox outbreaks, where lesions were mostly seen on the chest, hands, and feet, the new form causes milder symptoms and lesions on the genitals. That makes it harder to spot, meaning people might also sicken others without knowing they are infected. Before the 2022 outbreak, the disease had mostly been seen in sporadic outbreaks in Central and West Africa, when people came into close contact with infected wild animals. Western countries during the 2022 outbreak mostly shut down the spread of Mpox with the help of vaccines and treatment. but very few of those have been available in Africa. Marx of the London School of Hygiene and Tropical Medicine said that in the absence of Mpox vaccines licensed in the West, officials could consider inoculating people against smallpox, a related disease. And I quote, "We need a large supply of vaccines so that we can vaccinate population mostly at risk," he said, adding that would mean sex workers, children, and others living in outbreak regions. Congo hasn't received any of the Mpox vaccine it has requested. Congolese authorities said they have asked for 4 million doses. Chris Kasita Osako, coordinator of Congo Monkeypox Response Committee, told the Associated Press. Kasita Osako said those will mostly be used for children under 18. The United States and Japan are the two countries that have positioned themselves to give vaccines in our country, Kasita Osako said. Dr. Dimi Ogoina, a Nigerian Mpox expert who chaired World Health Organization Emergency Committee, said there were still significant gaps in understanding how smallpox is spreading in Africa. He called for stronger surveillance to track the outbreaks. "We are working blindly when we are not able to test all suspected cases," Ogoina said. Although World Health Organization emergency declaration is meant to spur donor agencies and countries into action, the global response to previous declaration has been mixed. Dr. Boguma Tihaji, an infectious diseases expert at Emory University, said the last World Health Organization emergency declaration for Mpox did very little to move the needle on getting things like diagnostic tests, medicines, and vaccines to Africa. The world has a real opportunity here to act in a decisive manner and not to repeat past mistakes that will take an emergency declaration, Tihaji said.